Now, let's begin this educational session. I'm so pleased to introduce you all to Caroline Gramer. Caroline Gramer has a Bachelor's of Psychology with a focus on neuroscience, biomedical ethics from the University of Toronto, a Bachelor's of Social Work from the University of Victoria, and a Master's of Social Work from the University of British Columbia. She's a full-time professor at Seneca College in the Faculty of Applied Arts and Science, Department of Community Services, and cross-appointed to the Social Service Worker Gerontology Diploma Program and the Bachelor in Therapeutic Recreational Program since 2005. Prior to this, she worked in a variety of group home settings and then transitioned to a palliative care setting where she first supported those dying of AIDS and eventually moved into working with older adults in long-term care facilities. Caroline has been a practicing psychotherapist for the past 20 years, using cognitive behavioral therapy and focusing on trauma, depression, anxiety, grief, and geriatric and caregiver issues. Additionally, she speaks at senior support services agencies and senior community centers to teach older adults about safe sex and sexuality in older adulthood. She has been a gerontechnology consultant for the past 25 years, engaged with global think tanks on how technology can allow for aging in place. In this role, she designs and implements studies to test industry technology with older adults and run clinical trials on medical-grade technology that assists older adults in maintaining or improving their mobility and independence. Please join me in welcoming Caroline.
Thank you so much. Hello, everybody out there and here. Thank you for joining me. And thank you for the introduction. I listen to myself and think, ugh. So I'd just like to say hello and start about digital tech and technology in older adults. This is my pet area, so I do other things, but what I really enjoy doing in terms of research has to do with technology and aging in place and how we can leverage technology and the internet and access these tools in order to keep our older adults in place. Now, this came about, this project, because of the pandemic. I've been working in this area for a long time. However, the pandemic really shone and magnified a light on the problems we have with older adults and access to technology. And when we locked down in 2020, many of our older adults were completely locked out. And so we started to worry about how do we even know how many older adults are out there who are disengaged and disconnected because of these lockdown protocols, and how many older adults need our help. And the City of Toronto was concerned with this as a broad spectrum look at everyone who was locked out and needed digital access, and looking at who was most vulnerable. And we worked with a variety of different higher education institutions, and we worked in a really strong collaborative model and everybody had their area and their cohort that they wanted to work with. Nobody was looking at older adults. So I stepped in because they just kind of get left behind, even though the news was all about their deaths and their lockouts, and families were not able to be with their older adults, and they weren't there for their last moments in the hospitals, in the long-term care facilities, in the retirement homes. And yet it wasn't being studied and it wasn't being identified. So we took it on at Seneca College in the Social Service Worker Gerontology Department. We had students already who were on the front lines, so we knew what was going on in the long-term care facilities, in the communities with the senior supportive services, and in the retirement homes. But we didn't know what we were going to do about it. The first photo, as you can see here, I know it's white older adults. It's actually my mom and dad, and it's sort of personal for me because my mom passed away in 2020. So that's why we have this to show that my mom, who hates technology, learned how to use it as well, and the intergenerational component. So I'm going to, when I look at this presentation today, I'm going to be taking it from the study itself, but also as a professor and teaching. And if you're a mentor or a field supervisor in the profession and you're on the front line and you want to do research, I'm going to be talking about working with students and doing this kind of research as well. So there's two pieces to this. These are our project collaborators. As you can see, it's an enormous group of people tremendously talented. I really love this model. We all got along so well, and now we're at a point where we're actually forging new pathways to do new projects together. I can't emphasize enough when the group of higher education institutions get together to do something good, they do it really well. And if you want to see the reports that are already being generated, they're posted on the toronto.ca website under the digital access mandate that they have right now. So the project collaborators really helped. I would give them information and ask them to look at how many older adults are out there that they can phone and find out who's disconnected and who's disengaged. And they would come to me and ask me what I needed to know about this this disconnect, and they would want to know more about what's happening out there from the front lines. So I'm not going to list all the people there, but again, it's a tremendous number of people, really imaginative, incredibly intelligent, and very generous with our knowledge and our information. And I felt very honored to work with them. What I do have to say about it is the higher institutions that we actually worked with was the City of Toronto, U of T, U of T Scarborough campus, Toronto Metropolitan University, York University, Humber, and Seneca. So those were all the higher institutions that we were working with. And I just realized I'm staring at my land acknowledgement, and I forgot to do my land acknowledgement. So I will do that right now. My apologies. So we acknowledge the land we are meeting on is the traditional territory of many nations, including the Mississaugas of the Credit and the Anishinaabe, the Chippewa and the Haudenosaunee, and the Wendat people, and is now home to many diverse nations, Inuit, Métis, and the Métis people. We also acknowledge that Toronto is covered by the Treaty 13 with the Mississauga of the Credits. So my apologies, but I usually jump into things and I forget about the land acknowledgement. So these were our project collaborators. And again, you can find most of their reports on the toronto.ca. My report is still being worked with because I'm working with students they're learning how to write a report. So these are like I said, I'm going to come at this in two directions. One will be the actual study, and the other part will be how to work with students and from a teaching model, teach students how to do research and get them engaged in the process. So the study itself was a mixed method. We did quantitative and qualitative research, and I find it really helpful to do both, and mixed method is becoming more and more popular because you need a balance of both. You need the numbers to understand what you're looking at, and then you need the qualitative piece to actually put a lens on what's going on and what do the numbers actually mean. So the only issue we came up with the qualitative piece was we were doing this from phase 1 in the pandemic, so all of our contacts were redeployed, and it was very hard to get a hold of people in order to do this study and fill out our forms. So we didn't generate enough in terms of numbers. I'll give you the best numbers that we have, but we did manage to get some representative picture of what's going on out there. So quantitatively speaking, what we did was we used online surveys that the students developed. So they learned how to do an online survey, and they learned how important each word in an online survey is. You can't just ask questions. You have to be really specific about the questions you're asking. And I have to give thanks to the collaborative team because they were helping my students as well and teaching them how to write a survey, because my students, I allowed them to be in on, and they allowed my students to be in on these meetings, these collaborative meetings. So they also learned about what it's like to work in a very large collaborative team on a big goal. So the quantitative online surveys were for the 3 most common settings of older adults. We looked at long-term care homes. So they were sent to all the long-term care homes in all 6 boroughs. Only 4 homes responded out of the 75, and approximately that was representing 532 to 700 residents. All I can say is it was mostly because we were in the crisis, and I know that a lot of the people who would have normally been answering these questions were literally on the front lines dealing with the crisis at hand and were being redeployed. So I appreciate what we got, but it wasn't what I had hoped for in terms of the number of long-term care facilities that participated. That being said, We looked at, the response was 50% nonprofit homes and 50% for-profit homes completed it. 2 in Scarborough, 1 in Etobicoke, and 1 in the Old City of Toronto. We didn't look specifically at addresses or the names of homes. What we did was we used the first 3 postal code digits, so I can only speak to areas, and that was in order to keep it as anonymous as possible so that people felt safe completing these forms. 3/4 of these homes provided internet to the rooms directly. All 4 homes reported more than half of their residents required one-to-one assistance using the internet. So they needed somebody there with them. They couldn't do it on their own. And 1 home reported all of their residents, in fact, required one-to-one assistance when using devices and the internet. So something that stood out for us was that most long-term care homes do not have Wi-Fi access into every room. And we're advocating and pushing towards every long-term care home. It should be a licensing requirement, have access within the room to Wi-Fi. We're also looking at devices, and what we found was the other problem was devices. We only had, the long-term care homes only had limited devices, maybe 1 per floor or 2 per floor, depending on how large the facility was, which meant that they had to wipe down the devices. And so we're advocating for every room, every bed, to have a tablet, a dedicated tablet. And the home would own it, but the person who lives in that bed in long-term care homes would have free access to it whenever they want with the Wi-Fi. And it would be loaded up with whatever the main software pieces and apps that are most important to older adults, so that they'd have full access. 3/4 of this, or 100% of the residents preferred tablets as their device, which was a surprise to us. So what we were finding in long-term care is they much preferred tablets over laptops or cell phones or computers. And I can understand why. They're more portable, yet they're larger than a phone, so they can see them. And if they have visual impairments, if they have hearing impairments, or they have digit impairments, things like arthritis, this was easier to manage than a phone. And that, it did surprise us, but then we started to understand why that was happening. 2 out of the 4 homes used internet for social media and virtual calls. 1/4 of the homes used it to live stream entertainment, and 1/4 of the homes used it for chatting and texting. So these were the reasons why they used these devices in long-term care settings. We also looked at retirement home settings, so we sent it to all the retirement homes in all 6 boroughs. More retirement homes responded, so 12 homes responded. That's approximately 1,400 residents to 2,400 residents. So 6 out of the 12 homes that responded were from North York. 3 out of the 12 were from the Old City of Toronto. 2 were from Scarborough, and 1 was from East York. And again, I can't tell you which homes responded. We only got the first 3 postal code digits in order to keep it more anonymous, but also identify regions and boroughs. So 6 out of the 12 homes were for-profit homes, and the other 50% were not-for-profit homes. I don't know what this means because we don't have enough numbers. It's just a raw number that we don't know what to do with because statistically it doesn't have any significance. But it was interesting to see that it was 50-50 for-profit and not-for-profit retirement homes. 9 out of the 12 homes do not provide internet access within the resident suites, so residents have to purchase their own internet access within their suites. 7 out of 9 of these homes had dedicated computer rooms, which was nice that they had these computer rooms that the residents could go to. However, during lockdown, they were locked out from the rooms. So that was another barrier that we'll talk about a little later. So even though the computer rooms exist, they were locked down during the pandemic. 8 out of the 9 of these homes, residents paid for their own in-suite internet. So again, internet access was not being brought into the suite or into the bed or into the room directly, and it was the responsibility of the older adult to pay for that on their own. In terms of devices, 7 out of the 12 homes reported they can use the internet independently. Of these, 4 out of the 7 homes reported that up to 75% of had their own devices. 3 out of the 7 homes had less than 25% of them own devices. So again, in a retirement home setting, they were responsible for having their own devices. The homes didn't provide devices, but might have provided that computer room, which was again locked down during COVID, during phase 1 and 2. 9 out of 12 residents preferred a tablet. So again, we're seeing the majority of older adults prefer a tablet over any other type of device. 3 out of 12 used their smartphone or laptop, and we'll go into the smartphone and the popularity of the smartphone, what was going on and what we uncovered through the qualitative component. 7 out of 12, so the majority of them used their internet for emails. 2 out of the 12 used them for texting and chatting, and the remaining used it for gaming, live streaming, and social media. So the most popular, again, reason for using the internet was email and then texting and chatting. In terms of senior services in the community, which was our other like independent home settings, so older adults who are living independently in the community, we sent them to all the CSS agencies in all the 6 boroughs. So this included target shelters that serviced higher rates of older adults, the Anishwabi Health Center and the Aboriginal Housing Services Center. I can't tell you specifically what the results were because, again, we only used the 3-digit postal code. I can only tell you the areas and the boroughs, which is what the City of Toronto was looking for. They weren't looking at specific agencies or very specific neighborhoods. They were looking at the boroughs. 10 agencies responded. This represented approximately 39,835 residents. There was no identifier, like I said, except for the first 3 digits of the postal codes. The responses from 3 out of the 10 were in Old Toronto. 3 were in Scarborough, and those were fluctuating numbers. 1 was in Etobicoke and North York, and then York itself, and then there was East York. So the numbers were better represented in terms of the larger populations. So we can see that it sort of represents the populations in these boroughs. 6 out of the 10 agencies reported 50% to 74% of their clients were low income. So all of them were looking at low-income older adults. 2 out of the 10 reported that 75% to 100% of their clients were also low income. And 1 agency in Northwest Scarborough reported less than 50% of their clients are low income. And there was 1 for-profit agency near Leaside and the Bridle Path that reported none of their clients were low income. So for the most part, the CSS agencies were working, most of their clients were low income, is what came out of that. The Scarborough reported less than 25% of their clients had access to the internet. So the majority of their clients in Scarborough did not have access to the internet. Only 10% in Etobicoke had access to the internet, and in York, only 16%. We found that North York, the Bathurst Manor, Willowdale, and Westminster Branson area actually had the highest rate of internet access. So we were able to provide this data to the City of Toronto to recognize certain areas were actually more marginalized than other areas. But North York had the wealthiest or richest access as opposed to the other regions that we looked at. The agency provided, we talked about the agencies, and the agencies reported that they would provide free Wi-Fi to the buildings that they were dedicated to. So a number of these CSS agencies have dedicated older adult buildings that they actually manage and look after, and they had installed free Wi-Fi throughout those buildings in those older adults and community settings. Scarborough in the Malvern, Deer Park, and Brimley Forest area was one of them, and North York in the Bathurst Manor and Willowdale area. So we'll talk about funding in terms of CSS agencies and where they're looking for funding, because they know that if they're managing these buildings with older adults in them, they know who's in there, they know who has access, and they're trying to supply Wi-Fi access throughout the building as a starting point. Most of the clients prefer tablets, even in the community, over any other device, with smartphones smartphones being the second highest rating. And I have 2 little stars there because we'll talk about the smartphones, like I said, a little later. And then 3 out of 8 agencies reported older adults use internet for emails. So again, the most popular use right now is emails. 3 out of 8 use it for social media and to connect live online. One agency reported that clients use it for wellness programs and services. So as phase 1, as the CSS agency started to get used to being online, they started to develop remote programming. So this is reflecting that remote programming, that if an older adult had access and knew how to use a computer and had high-speed internet and was aware of the CSS agency and their remote programming, they could engage in that. So there were a number of steps to get there, but they did have that as one of their responses. One agency reports clients use it for streaming entertainment content, live movies and music. So what we're seeing in all 3 settings, we were seeing a consistency in terms of lack of access, in terms of device preference, and in terms of what they're using the internet for. Let's move to the qualitative component. So because we didn't have enough numbers statistically to run it through an SPSS program, what we only have are the raw numbers that you could reflect on. But with that in mind, we then stepped into the qualitative lens, which of course I prefer more, because you see the reasons, you see the answers for why the numbers exist. And so we did qualitative interviews with older adults, family members, and healthcare workers. The interviews were conducted in English, Mandarin, Cantonese, Vietnamese, Tagalog, Spanish, Italian, Urdu, Hindi, and Punjabi. These were our students in their languages. So we were limited, and it was unfortunate. We did have other communities reach out to us, the Greek community, the Russian community, and unfortunately we couldn't provide them, or we couldn't assess them in their own languages because we just didn't have the translators available to do that. So we know we're missing huge communities out there, and we're aware of that and would like to see that in the future. We'd like to see some studies happening in those languages. But these were the languages we could cover effectively and did well with. In the end, we interviewed 14 older adults who were living in Toronto. We interviewed them by phone. 4 family members who have older adults who live in Toronto, and 9 frontline healthcare workers who worked with elders who live in Toronto. The eligibility requirements were that the older adults had to be 60 years of age and up. They had to have an M postal code, so it had to start with an M, which determined they were in Toronto, and their competency was assumed. So we assumed that they had competency, and we would go while we go through the consent process. They were anonymous and coded as such. The compensation for participating in the project was 6 1-to-1 1-hour training sessions on whatever device that they had, and internet navigation and safety in the internet. And the safety in the internet became a mandatory lesson, whether they wanted it or not. So we just felt as a team, as the students, and we talked about it, how important it was to feel safe on the internet, protect themselves, and identify when there's fraudulent emails coming at them or fraudulent advertising. And so we made it mandatory, whether they liked it or not. They had to go through it, and we tested them just like students. And the students had a really good time with this, as did the older adults, because the students created the quizzes, would email them fraudulent emails, and if they got a response, they would tell them, you weren't supposed to answer that. That was a fraudulent email. So they had a lot of fun, and they built this relationship with these participants who became more and more confident when they understood the safety, how to be safe on the internet, which is one of the things that come out of the barriers that we'll talk about at the end of the presentation. So the other thing that we offered was the baseline assessment. So we took a baseline assessment of what their knowledge was and what they had access to, and we took that by phone. If there was a participant who did not have access to the internet, we actually hooked them up. So we went to the Toronto Public Libraries and worked with them, because this is another barrier that we identified. The Toronto Public Libraries was offering free Wi-Fi high-speed hotspotting programming to their communities, and they were also offering free device loans. And they were offering it to children of school age, who the TDSB was already offering that, and the Toronto Catholic District School Board was already offering it. They were offering it to adolescents and youth, who again, the high schools were offering this as well. And then they were offering it to people of employable age so that they could find work. And again, that was being offered by a lot of the employment centers. So it was almost a redundant package, but they weren't offering it to older adults. And so my students found that out, and so I worked with Toronto Public Libraries because I didn't understand why they weren't offering it to older adults. And they said, well, they didn't seem to show any interest, and they showed me the data. And data doesn't always show the picture, the full picture. And when we looked at the data, I said, well, the reason why they're low users is because you've locked them out of the libraries and they don't have their own devices, so they're not sitting on your stairs and your steps trying to get the free Wi-Fi. In fact, they're isolated in their home and they're not leaving. So the low numbers aren't a representation of disinterest. The low numbers are that's how far from the margins they are. That's how isolated they are. So we struck a deal, and TPL was wonderful. They opened it up to the older adults, and our students hooked our participants up with their free Wi-Fi hotspotting programs and their loans, and also raised money. So the student team that we worked with also learned how to do funding and raise money to get tablets, free tablets, that we would have them wiped. And the IT team at Seneca helped wipe the tablets and help wipe the laptops and put on the software that we felt was most important to these older adults. Delivery was the second barrier, so we didn't know how to deliver this. And even the Wi-Fi hotspotting, there was a router issue. And again, I remind you, we were in phase 1 and phase 2 where everybody was on lockdown and nobody was entering homes. So this became a problem as well. And we asked the CSS agencies to have one of their designates who goes to, let's say, deliver Meals on Wheels. And we would set up a time to match when they would be delivering the Meals on Wheels, and the older adult would know who they are and why they're coming in, and they would set up those routers so that they had access, so that they could actually use everything. So we found these barriers upon barriers upon barriers, and it was more trial and error, but it was a great learning experience for the students as well, because they were learning about barriers and systemic issues, and it helped also to enlighten the team and the City of Toronto as to what the barriers were and what real access means. So again, we would provide them with the devices, and we provided them with the Wi-Fi hotspotting programs and hook them up before we could train them. And then they would decide whether they want that training or not. That was up to them. The open-ended question that we used for the study was, what has it been like to live without digital access since COVID started? So it was a very simple question, but it took us a long time to put that wording together. And I'm not sure how well it translated. I spoke to the team about how they translated that. And so there are some issues about the translation of that question into different languages and what it means. And so that's one of the problems with a qualitative study, is that question is me, the Anglo speaker, and how does that translate now into other languages so that it makes sense? The same question was given for family members and healthcare workers. The modification of this question was, what has it been like for you to connect with your loved ones who are older adults over 60 and living in Toronto without internet communication? And what has it been like for you working with older adults who do not have digital access? So we'll talk a little bit about the results that the healthcare workers and the family members were also wanting to add to this study. Just a quick thing about the methodology. So we used grounded theory. I decided to use Atlas TI as the software program. It was really trying to understand, should we use Taggart, should we use NVivo, should we use Atlas? Atlas, for this particular project, had the finesse and had the detailed variables that I needed to work with. Taggart's too broad, and NVivo didn't have certain aspects to it that I knew Atlas TI had. So the students, not only did they have to learn how to do surveys and have to learn how to fundraise and have to learn how to write grants, also had to learn and were certified on Atlas TI training. So they're all certified Atlas TI users now, which was a process for them. But because we worked as a group, we often had these virtual sessions where we were all in, scratching our heads trying to figure out what to do. But they got their training and they got their certification, and they then applied it to the study. What you see here is something I believe in terms of doing qualitative studies in social service work or social work, is the having all of the students, and they only had to fill out what they felt comfortable with. They didn't have to give any information that they didn't feel comfortable with. But I had 9 research students. 8 of them were social service workers in the gerontology department doing their field placement with me, and 1 was an MSW from York University. And in order to be transparent in a qualitative study process, I believe that social location is really important. So this is just an example of the students. Each student provided a photo, provided what they were doing in terms of their study, and they also, as you can see the diagram, the circles, they also provided their social location, and they learned about this in their studies in the program. And we talked about the more circles you see at the outer circles, the further away from the margin, or the further to the margins they are. So that oppression piece, and looking at where our privileges are versus where are our levels of oppression. And so it was very interesting for the students to talk about looking at where they were coming from. Many of our students were international students. Most of the students were students, visible minorities. So we had students coming from the West Indies. We had them coming from the Philippines, from China, from Vietnam, really from just about everywhere. And we only had 2 students who were Canadian, born in Canada. So it was an interesting dialogue that I think the students learned a lot from each other, but it also helped in terms of using qualitative methodology, because the reflections on the data that we saw, it's really important to have a social location. It is about the way we see the world and how we reflect on the data that we're looking at. And I think it's important that we disclose where we're coming from in terms of our social location, so there's an honesty piece to that. So it was really important to me that the social locations of all of us were present. And again, up to the comfort level of whatever they wanted to fill out. So we did the best we could to do that, as you can see, so that when we look at the reflection of the data, everyone looked at all of the 14 participants and reflected on all of the things they were saying. And we were all coming from different perspectives. So the results of the study and the themes come out of a very pluralistic lens, which I'm happy about. In terms of the students, so they assessed the participants for eligibility. They learned about informed consent. They had to develop an informed consent form. We talked about how do you keep the data protected? How do you keep participants anonymous and protected? And so we talked about the firewalls and how to store data and input data, and input data into the system. And we were sharing, because we were all virtual. So we were sharing across the system. So we had to look at the locked systems we needed to use in order to make sure that the data that we were sharing amongst the team was still protected and invulnerable to hacking or whatever else may be out there. Students received calls and interviewed the participants in the language of their preference. So they would interview them in English or in their language of preference. Students recorded the interview as well with what we call Otter AI. So we cheated. Instead of the students having to physically transcribe everything, Otter AI does it for you, and it's free. So we really, and it does it in several different languages. So it can record everything and transcribe it in many different languages. And we used Google Translate and the students to translate, because Google Translate doesn't always translate properly. So they were the translators. So they would, if it was in a language other than English, it was recorded on Otter AI, and the students learned how to do that. And then it was and transcribed by Otter AI, and then it was run through either Google Translate, or my preference was for the students to translate it because they better understood the nuances of their own languages than Google could. So, and we talked about that. We watched as we translated through Google Translate, and then we watched as students, and that's not exactly what this person meant. I said, well, you're going to have to rewrite it then. And so it was really another learning opportunity for students in terms of the limits to the software. The transcriptions were then entered into the system. The data was analyzed by myself and the students using, of course, the Atlas TI9 software. All students, I will say Atlas TI9 software is laborious. So if you don't have to use it and you're not looking for very specific details, I would probably recommend using Tagit, which is much easier and is free. And I'd like to thank the University of Toronto Scarborough students and their professor who was collaborating on the project, because he had his students who were learning how to do Tagit learn how to do it and then trained our students. So that was a lot of fun too. So it was nice to see that collaboration among students in different schools, teaching each other different tools to use while they're studying. We noted the reflective process. It took a long time. Atlas TI takes a long time to reflect on the data. And there were times where we would leave it for a week or two because you just can't look at the data constantly and you need that break. So it's a lengthier process than quantitative studies, but I feel it's a richer process to understand what's going on. We then identified themes. So we talked about what we thought the themes would be based on what the analysis of the data, and the barriers to access were identified. Recommendations were made. And out of the recommendations, phase 1 of Seneca's SSWG project on digitally training older adults began. So this is just a sample of the type of work you can do on Atlas TI9 to take the data of all of the quotes and break them down into whatever you want them to look like as we reflect on them. So one of the pieces we looked at was looking at what are the benefits of digital access according to what our participants said. And so we'll talk about that and the results in a minute. This one was, we also analyzed older adults and their desire to learn. And did they, in fact, have the desire to learn? And that interesting data came out of that, and a lot of reflection on what the older adults had to say about it. And then we also looked at an analysis of the perceived barriers. So these are the barriers that we knew there were certain barriers, but we didn't know about other barriers that these participants actually told us about and made us aware of. So this also helped us to understand when they were giving us the data, we were looking at it and looking at what they were saying and the words they were using and identifying. They were able to clearly identify what the perceived barriers were to digital access. So I'm not going to go through them in detail because it's a lot of information and it's a very little time, but this is how this is what we did with the analysis on many levels. So there were 5 emerging themes that we developed and we saw coming out of the data. The first one was redefining the concept of digital access. So when the City of Toronto talked about digital access, they were looking at the infrastructure they're currently building so that Wi-Fi is free throughout the entire city. So there's a huge project going on where they're developing this infrastructure in order for there to be free Wi-Fi through the city. And many cities in Europe have this already. So Toronto's a little bit behind, but they're trying to work towards that. And that was their definition of digital access, high-speed digital access. What this study brought to light was digital access means more than just having access to high-speed internet. So what we found was that you needed high-speed, reliable internet, plus you needed a device like a tablet, preferred when it comes to an older adult, plus someone to deliver and set up the system, plus training on the device and navigating the internet, plus often one-to-one assistance in using the device for those who are most frail, vulnerable older adults, for example, people with cognitive impairments, persons with multiple sensory deficits, and persons with functional impairments or fine motor skill issues. So again, digital access was more than just offering free high-speed internet throughout the city. And it's something we brought to the mayor and the executive committee, and the students learned how to do a deposition, as did I, because I didn't know how to do one either. And when we deposed, I couldn't emphasize enough that they have to change their concept of what digital access means, that it is more than just simply offering free Wi-Fi, and that without all of these other components, it wasn't accessible, and they had to meet all of these standards. So that was the first theme of redefining digital access. The next one we realized was internalized incompetence. So what we were finding out through what the older adults were saying was that they have this internalized incompetence that is brought upon by the dominant social message that they can't learn new technology or they don't know how to navigate the internet. And they believe this message. And we saw that internalized dominance, and they're reluctant, therefore, to engage because they don't want to make a mistake, or there's a safety issue and they're afraid they're going to be defrauded. And the learning process itself, the I'm too old to learn. But that only happened until they began training. And what we noticed was, and what the students kept saying was, they're learning really quickly and they're really enjoying the learning. That patience is a major piece of the training. So the students had a lot of patience, but that they were retaining the information and they were learning it and they were wanting to learn more. So that was really interesting in terms of the results. But that internalized incompetence, we have to look at that in terms of how we message to older adults and what are the messages we're sending them in the digital world. Digital learning needs have to be purposeful. So older adults tend to want to learn something if it has meaning to them. And one of the examples I always give is my mom, who doesn't know how to turn a computer on. And she had no interest in the phones, the iPhones, the tablets, nothing. She wanted nothing to do with devices or the internet, except we trained her. So we wouldn't answer the phone when it rang, and that forced her to text us, and we would answer her immediately. So a little bit of classical conditioning going on. And she knew if she wanted to get a hold of us, she would have to text us. And then I introduced her to the Flip app, which is I know many of you knew that, with the flyers and the coupons for the week. And that was important to her because she loves a deal. And she also price matched, and she always had to bring in all her flyers to the stores. And I said, no, you don't have to do that. You can just do it on your phone. She learned very quickly how to price match and became very efficient with the phone, and then learned how to use the tablet for YouTube videos that she liked to watch. And she learned how to take pictures and video and send it. We would only send our photos through the text. So she was forced to learn how to do that, or she didn't get to see photos. So I think older adults, and that's just one example, but there's many, many examples of if we give older adults a meaningful training that's purposeful, that helps them, they're more likely to learn and want to engage in that digital world. We also learned very quickly, unfortunately, that social isolation is as lethal as COVID itself for older adults. So the older adults had been in solitary confinement for 2 years and reporting higher rates of suicidal ideation to our team while they were being interviewed, and increased frailty without the human connection of others. Those already engaged in digital communities were reporting higher rates of resiliency during the lockdown. So it became really important to connect over the internet if you could. Students the students we had that were in long-term care homes throughout the last 2 years in community field placements have also reported decreased physical mobility and strength, decreased cognitive abilities, increased levels of depression and anxiety, decreased levels of motivation, and increased reports of suicidal ideation, especially where little or no contact or digital contact has been maintained. I think that's a critical point we really have to look at. And I know as we already know this as social workers, but I can't emphasize enough the level of trauma that these older adults, especially in long-term care homes, who survived COVID, have been left with. And we have to address that in terms of connecting them to the outside world through these digital tools. Older adults have been left behind in the transition to the digital world. So while we efficiently and effectively moved everything to the digital world, we completely left older adults behind. There were fewer resources that were actually available to them. Libraries were closed, and they used their public libraries and their seniors' community centers they used those computers, and that's where they did all their computer work, and now it was shut down. Discounts to the internet and free devices often did not apply to older adults. And we phoned the companies and couldn't understand why they wouldn't provide that discount to older adults as well. Websites are not intuitive for older adults with more than 3 clicks to get what they want. They often, as we know, when the vaccine came out, they had to register to make an appointment to get a vaccine. And navigating that was a nightmare, and we actually had to throw the study aside and help these older adults who were calling us spontaneously, just to help them navigate and register through the vaccines online, and then as well to get the appointment and then get transportation. Like we were doing social service work, we were doing social work and casework, and not our study, because it was such an urgent crisis. So, and we let the mayor know. We let the mayor know that this was happening, that this wonderful online system was not so wonderful. And being that I've been working in technology with older adults for a long time now, what I've noticed is it's a sort of baseball game. 3 strikes, you're out, 3 clicks, and they're done. If they can't get to what they want by the 3rd click, you've lost them. They get very frustrated and they give up. So one of the things that we looked at is what we saw was that the digital world is made for a younger generation and is not designed to be intuitive for older adults. One of the things that we were looking at as solutions was the trainers need to be trained on how to teach older adults in using the devices and navigating the internet, safety and security on the internet, troubleshooting when things go wrong, and learn how to do that. And it's become increasingly difficult to reconnect with basic health, financial services, wellness services that all wind up on the internet, and more health services are going digital and virtual. So very quickly, identifying the barriers. So there were many barriers. Cost was one. The monthly internet fees for high-speed, reliable internet were simply not affordable to low-income seniors. And many seniors who maybe could afford it just didn't see it worthwhile. They didn't find that it was an expense worth having. They also had to afford devices. What we found was, while many of them had cell phones, the cell phones were given to them by families and part of a family plan. So it's not that they wanted the cell phone, that was the device they were given. And again, they preferred tablets. It was more difficult to work with a smaller device like a cell phone. Digital fluency and literacy. So all the training centers were all shut down. So Apple Genius bars, which are usually filled with older adults during the day, seniors community centers, public libraries were all shut down. There was nowhere older adults could go to learn how to use the devices and navigate the internet. And they've been closed now for almost 2 years. They're just slowly opening up now. So this completely cut them off from the community, their world. Digital access, all the stores, the libraries, the community centers have been shut down for almost 2 years. There were main sources of access for them. Website platforms are very difficult to navigate. Again, they're geared towards millennials and Gen Zs and maybe, us Gen Xers, but they're not intuitive and very difficult to navigate. And there was a lack of one-to-one assistance for older adults who are the most marginalized with this pandemic and the least likely to have that one-to-one assistance. And they needed, in order to operate the devices themselves, connect with the internet and communicate virtually. So they required one-to-one, sometimes hand-over-hand assistance in a lockdown environment. What were the solutions? So again, we had a deposition in front of the mayor and the executive committee of Toronto. And the city needs to press the 2 major players, Rogers and Bell, for funding for free high-speed internet installation and low monthly access of $5 to $10 for any older adult who is identified by local senior support agencies as low income. No questions asked, because right now they're asking for income, which can be picked up by these agencies through grants and fundraising delivered by the company and installed for free using the IPAC or PPE precautions. 2, that agencies in the city can broker a deal for free tablets for all older adults over the age of 70. We found younger older adults already had devices, so they don't really need them, who are low income and no questions asked again, and preloaded with basic apps, mailed directly or delivered directly to the recipient using contactless methods. 3, a licensing requirement for all long-term care homes to provide each bed with a free tablet and free Wi-Fi that reaches to each room. Most of these long-term care homes are for-profit, so I'm saying let them pick up the tab with no rate increases that are passed on to the resident or the family. Non-for-profits can apply for capital grant funding for this initiative, and it should be effective immediately. So we need to get it into the licensing in order to get the for-profit homes to actually have to do it. A licensing requirement for all long-term care homes and policy should be in place to mandate additional staff, like activation aides, to deliver one-to-one digital engagement and virtual visits with families and friends daily for 20 minutes for all residents in the memory units and secured units and residents identified as having significant functional impairments and requiring one-to-one support with their device. So we have some lofty demands. One-to-one small group and online virtual training can be delivered by a collective network of high school CAP programs. So the students in high schools who need that 40 hours or 80 hours of CAP volunteer hours could be doing this as an intergenerational programming. Post-secondary field placements could provide this kind of training where relevant, and an initiative to train seniors to train their own cohort as a sustainable option with cooperation of the local senior support agencies and long-term cares and retirement homes. Of course, a criminal record check and vulnerability sector check will need to be done. Plus a supervisor to oversee the training as well as how things are going with the people they're working with, and feedback from the clients and residents. And students as well would be trained on how to work with older adults, how older adults learn, risk assessments, identifying elder abuse and safety and security on the internet prior to working with these older adults. We can also engage faith-based organizations, public libraries, and community centers with volunteers to virtually train older adults. Right now, we have one project with the Markham Public Library where we're virtually our students are in a field placement training the older adults for the members of that library. And their sessions are on, they're filled. There's a wait list. So there's certainly an interest and a need. Funding in the community for support to engage digitally in a person's home. While a PSW is providing care, it should be mandatory and part of the individualized care plan for the PSW to work with the older adult to connect with their family and friends through a tablet or a laptop or digital device. However, they should not be using their own devices, that's one of the things we found, that the healthcare workers on the front line were using their own data, their own devices in order to connect their clients to their loved ones. And that should be something that the Local Health Integration Network, Ontario Health Teams, whatever we're calling ourselves these days, they should be funding that, and it should be coming through their funding. They should be providing those devices to the nurses or the PSWs who are going into the homes, and they should be providing more, counting that time as mandated time. Quickly, what has Seneca College done since? So currently we're working with, like I said, the Markham Public Libraries, and we do that remotely, and I have field students who are working one-to-one and in small groups with older adults in a remote setting. We are working with community senior support service agencies to encourage older adults to self-identify and who want to learn about electronic devices and want to learn how to navigate the internet to come and contact us, and we will train them. We are providing 6 one-to-one free sessions, 1-hour sessions, and if they're calling us and they don't have anything, our students, as part of their learning and case management, will set them up. We'll find them the device for free. We'll set them up connect them with the Wi-Fi hotspotting programs from the libraries in York Region and in Toronto. We're ready to go. And TELUS is also, we have these low rate places that now are offering low rates for high-speed internet as well. The students are right now, who are working with me now, the others have graduated. The students working with me right now are developing a training manual for training older adults and how older adults learn. So they're learning about how older adults learn, and they're working on a training manual that they can put out there for other people to train older adults. And we're working with one long-term care home that would like us to teach their older adults to work remotely with their residents in their cognitive impairment unit, in their secured unit. We haven't quite figured out how to do that yet remotely. We still need people on site there. And if you have any ideas, I'd love to hear, but we have not been able to figure that problem out yet of how to teach somebody with significant cognitive impairments remotely. We really do need the one-to-one on site. And so right now we have students who are in placement in this long-term care home doing the one-to-one piece while that don't necessarily know how to train older adults, while we have our other students who are remotely who know how to training them. So we don't have a solve for that one yet. If you do have an older adult that you know of that's isolated, doesn't have equipment, doesn't have internet access, or has equipment, has internet access, wants to learn more, or is feeling timid about learning the internet and learning about their device, give us a call. I put my phone number up here for those older adults who don't have any devices to email or don't even have an email themselves. I also have my email address, and the students are ready, willing, and waiting to train these older adults, and we've been doing it for about a year now quite successfully. That's it. If you have any questions, please let me know.
Thank you so much for that very informative presentation. I'm just making sure. I think the sound's okay. I'll read you a few of the comments that were coming in, and
people are watching.
They're very positive. So one is such brilliant learning for the students and older adults, enriching one another's knowledge, skill, and likely for the students, EQ, by being a part of this study. Very informative, challenged some myths about older adults, even those that they have about themselves.
Oh, thank you.
And another one, this was very informative, Carolyn. I work with older adults in long-term care and in the community. Digital access is really important. Yeah. Funding is definitely needed for a lot of these programs.
Yeah, absolutely.
And one quick question, because I'm cognizant of the time, that came up was when you spoke of the qualitative part of your study, you had a series of interactive safety sessions. Is that something your team developed or accessed from an existing program?
We've developed something. We used the platform that Seneca actually trains faculty with. In terms, we have training we have to go through for safety and security on the internet. I used that platform, but we had to adapt it to something that was more intuitive for the older adults. So we're just learning how to do that, and the students have been developing this manual in order to do this training for safety and security. So we do have PowerPoints and presentations that we've developed, and the students have tests, like I said, where they send things out to their participant or their trainee, and if the trainee responds to it, they can see whether they've learned it or not. And then the next session, they talk about, this was fraudulent. I was testing you. You responded or opened up this attachment. You shouldn't have done that. And let's look at what gives it away. So there's an ongoing progression, and we check in with each client or each participant to see where they're at, and they have a satisfaction survey at the end of each session to make sure they understand the safety and security components as well as other components that they learn. I hope that answered the question. I'm not sure if it does or not.
I'm sure it does. Thank you very much.
Thank you if you stuck around to see me.
On behalf of the college, I would like to present you with a token of our appreciation.
Thank you.
The college has made a donation to Sunnybrook Adet Cancer Center, an organization chosen by you. This is a comprehensive cancer program committed to optimal evidence-based and tailored treatment plans. Thank you, Carolyn, so much.
Thank you. Thank you. Thank you, everybody. This was really fun.